Welcome to this episode of the Successful Encore Career Podcast. I'm Carol Ventresca, Executive Director of Employment for Seniors.
And I'm Brett Johnson, longtime supporter of Employment for Seniors and producer of the podcast. The Successful Encore Career Podcast program is presented by Employment for Seniors with the support from Central Ohio Area Agency on Aging, Nationwide Insurance, and InnoSource.
Brett, we have a great program today. We actually have two very special guests with us. Michelle Missler became the new director of the Franklin County Office on Aging this year. The needs of seniors and the issues of senior care are critical in our Central Ohio community as it is through the country. We are grateful to Michelle for joining us today to discuss the many issues surrounding senior services and her view of our future. We also want to thank Janet Caldwell for joining us today. Janet is the Communications Manager for the Franklin County Office on Aging. Well, Michelle and Janet, thank you both so much for your willingness to come to the mic with us. And the Franklin County Office on Aging has been a great partner and supporter of Employment for Seniors. So we are really looking forward to working with you for years to come.
Thank you guys so much. This is Michelle, and I am very excited to be here with you all and to shine a light on Franklin County Office on Aging in general, the Senior Options Program, but also my vision for the future of aging in Franklin County and how I hope to support that.
Now, Michelle, you've been involved with the aging community for many years. Before we go into the issues and your vision, let's talk a bit about you. Talk more about your background and how your career path brought you to Franklin County Office on Aging.
Yeah, thanks. So my career started in Franklin County at National Church Residences. I actually started as a service coordinator myself, working directly with older adults residing at Stafford Village and Stafford Court in Worthington, Ohio. My role there was to link and connect older adults residing in an affordable housing complex to services that they would need to help them age in place. From there, I moved forward with National Church Residences and started to work in their quality assurance program, providing that clinical oversight to many service coordinators across the country through the national perspective of that program. After that, I continued to support that work and help National Church Residences recognize the need to tell the story of aging and aging in place in a more holistic way. So we, as the director of the Quality Assurance and Support Service Program at National Church Residences, we really focused on, how seniors were aging in place in those communities, what story we were hearing about their needs, and how were we best connecting folks to those services and better connecting them to the greater ecosystem of services around them, like their healthcare systems. From there, I moved over to the Healthcare Collaborative of Greater Columbus. It's a smaller organization, smaller nonprofit in Franklin County that is focused primarily on how do we better work together? How do we collaborate better? How are we ensuring that we are all coming to the table in a collective way to try and make true impact? So my focus there was in the medical neighborhood, trying to connect both the community service providers and the healthcare providers in our community. And it taught me a lot about collaboration and about collective impact and how we all work better together to meet the needs of those around us. Through that work, there was an itch that kept appearing in my life that I knew I needed to scratch, and that was getting me back to the roots of the aging population that I was so passionate about that I had started 12 years prior to at NCR. And so when the Office on Aging position opened, the director of the Franklin County Office on Aging position opened, I knew that was most likely the best next step to merge both my experience in the community providing supports and services to the aging population, but then also adding that new lens and that new skill set of collaboration and collective impact to this population.
And it's so good to have you with us at Franklin County Aging. As I said, we've done so many different things together. Janet can talk a little bit about what we have been involved in, but also, Janet, tell us a little bit about yourself, too.
Well, I've been in the aging field for probably about 40 years. I've worked in all different types of settings, from lobbying to public relations, and I've been with the agency now for 24 years, servicing the seniors here in Franklin County, communicating what it is we do here at the Office on Aging.
That's fabulous. I think that if anybody in the community has not heard of Franklin County Office on Aging, they had to work at not hearing about it, because the programs are fabulous and everybody talks about how wonderful it has been over the years. So thank you for all of your service there too.
Thank you.
Well, I don't. Many of us have been through this. We've been caregivers. I was a caregiver. That's actually how I first came in contact with Franklin County Office on Aging, taking care of my dad. And having been a caregiver, I can say it is scary. There's nothing easy about dealing with an older relative, a friend, a partner who is going through some health issues, and it's really it's a constant state of fear as a caregiver. You just don't know what's going to happen next. Particularly, I was lucky my parents were here in Columbus, but boy, I hear from so many of our clients that are dealing with somebody who's not in Columbus, but they're not even in Ohio. So, family members are dealing with illness, lack of mobility, loneliness on the part of the older adult. So as the new leader for Franklin County Office on Aging, you're going to move us strategically forward, and lots of things are changing. Can you give us a little bit of your perspective on thoughts of the kind of where we are right now and your first steps?
Yeah, that's a great question. And you're exactly right. Aging at times, unfortunately, can be scaring, and the needs that arise through the aging process can be intimidating to both caregivers and those that are aging themselves. Our society is changing, so my future vision is really applying what's happening around us, and how do we anticipate the needs as a result of this societal shift. Years ago, folks used to primarily age in a nursing home environment, and we have shifted in society, and I don't know when that shift started, but it's definitely alive and well today, where it's about people's rights and the dignity at the end of their life, and how do we keep them where they want to age, and that is typically in their homes. And so how do we support those folks? And the Senior Options Program, with the support of the levy, is able to help those Franklin County residents do that in a way that, personally, I've never seen before. And it is an incredible gift that we're given, and we have a great opportunity to continuously enhance that. Data is telling us that by 2050, our older adult population will have doubled. And so how do we prepare for that? How do we think about that? How do we understand that the funds that we have today need to, be applied across a larger population? And those are all the things that I'm thinking about on a regular basis. And so I think it comes down to almost progressing us back to a time of, an older day of society where neighborhoods existed more, and we took care of our neighbors, and we weren't impacted by isolation as much. We were very thoughtful of those that live around us and how we support them. We volunteer more, things like that. Mm-hmm. I think that, that coupled with the supports and services that Senior Options is able to provide in our community due to those levy dollars, I think really gets us to a place of better impact and more coverage, to ensure that those lives that are aging in our community are taken care of the best that we can, with respecting their desire to do that in their community. There's great initiatives happening today that I'm really, really excited about for Franklin County, which are the Village. The Village model is something that I'm really, really passionate about. I think the age-friendly, I know we'll probably talk about that as we continue through this podcast, but I think, those types of initiatives where the folks that are funding those efforts and that work are showing that is an important and respectful way, allowing folks to age in place in our community.
Great. Wonderful.
I don't know how unique we are as a county across the state of Ohio or even across the United States, but most of the press is all focused on younger adults, millennials, keeping them here and such, but we've got a population that's going to continue to grow older and stay in place in Franklin County that I think Franklin County Office on Aging, amongst other agencies, are doing a great job of. But how do you, and I know this is a little bit off where we want to go with questions, but it came to mind while we're talking about this. We need to keep that in the forefront, though.
Absolutely. And, it's interesting as I, 10, 11 weeks into this role, but something that I learned definitely at the Healthcare Collaborative was the imperativeness of collaboration to meet the needs. And I often think, my role at the Office on Aging is a collaborative role with my counterpart over at Job and Family Services. Mm-hmm. And how do we both support each other? Because the folks that she's taking care of that are stricken by poverty today will be the older adults that we'll have to take care of. And so how do we all look at it as an ecosystem of our community and say, how are we all coming together to support? And we're ready. Franklin County's ready. We're excited to start that and figure out how we're all coming together to collaboratively support those that no matter where they are in their life cycle, because those are the caregivers. The millennials are the caregivers. We're all touched by aging. We're all aging every single day, and so at some point along the way, we're all going to touch this need, and so we have to be responsive. But I think it goes back to being proactive, going back earlier on to ensure that by the time we're aging, older adults, we're that 60 and older, that we have the supports and services in place. And then those of us who need extra supports and services, that we're being thoughtful about those to ensure that their needs are being met continuously.
Right.
I think that Franklin County is probably farther along than many of the other counties in Ohio. When we look at all the statistics, and Noble County is the one that hits me from the Scripps Gerontology program doing the population studies, that in 20 or 30 years, I think it's 20 years, Noble County will be 50% over 60. And you're like, how can an area economically thrive in an area that hasn't been economically thriving? How are they going to ever get better if you have that large of an older adult population and so many needs that haven't been met? But I think we are much better on target. Janet, do you think, all the things that we've been doing all of these years?
Oh, I think Franklin County is positioned to probably take care of our older adult population that we anticipate will be coming. With the Age Friendly initiative, we've been surveying people to see exactly what it is that they would like for the future, and we're hoping we'll be able to meet those needs. Right now, we're doing a very good job of taking care of the people that we are serving, and we're projecting that we'll continue that in the future.
Well, funding is always an issue. I know both of you can address this. The articles on caregiving in the recent Columbus Dispatch series told stories on the incredible obstacles family members face. But Franklin County has had some successful levies over the past 25 years. Both of you, what are your thoughts on today's funding needs as well as future needs? Because I know, Janet, you're well involved in regards to getting the word out about the levies as well as where the future holds for those, for both of you.
Well, we've just, I think it was a year ago last week, we passed our last levy by an amazing 84%. So we have been before the voters here in Franklin County every 5 years since 1992. And I'm happy to say that we have been supported by them every 5 years. And going forward, we hope that we'll still have that same support. Our levy does provide a lot of funding here in Franklin County, not only for senior options, but for grant agencies, much like Employment for Seniors. So we try our best to meet the needs of the people in the community and with the services that they need outside of senior options through those levy dollars.
Yeah, and I think, being new and coming in and learning the levy process and the imperativeness of it, I often call it a gift because it is a gift that our taxpayers are giving the aging population. And so, it's important for us to look at that and leverage that to find alternative funding streams as well, so that it's not continuously always going to be the same level of a burden. But, we will graciously accept the gift and put it to the good work. But we recognize that there's a growing population. And so we have to be thoughtful about how we utilize those dollars and find alternative dollars as well to help, ramp up more services. It is a beautiful thing, like Janet said, that we are able to take those levy dollars and outsource them into the community for the services that folks need. So, those levy dollars, they provide every senior or older adult that calls in with a case manager, which is a massive gift to be able to navigate the aging system when you get to the age of 60 and beyond. But also, I think it's an incredible program to be able to fund community agencies to provide the services that they're called to provide. And so it's a double opportunity, I believe, through those levy dollars that we can provide into the community. And I only see opportunities for that to continue to grow with diversification of those dollars and utilizing those levy dollars to say this is where we've, found impact and we want to continue to grow them.
Right.
I think it also states that you've been good stewards of the money as well. So you're walking into a great situation that you don't have to clean up a mess.
Right.
That you get to ride the wave that, we know what we're doing with this and continue to grow and even do better with it. So, that's a big congratulations. I mean, you don't get these levies approved over and over and over by not doing your job.
Yeah, that's true. That's very true.
Yeah.
It's a testament to the great work done prior to my arrival. That is for sure. And I take, great pride in knowing that that is the operations that was created for many, many years. And to come in as a new leader, it is a nice feeling. But it's also, I want it to continue to be as wonderful as it is today and just enhance it as we go along. So it meets more needs and is more responsive even more than today.
Well, and that kind of goes right into my next question to what's out there in innovation or some different issues and ideas that are coming around. We all hear about healthy lifestyles and, making sure that people are doing a better job of financial planning and that kind of thing. But are there some plans that you have for the agency and going forward that are going to sort of take us into a new direction?
We have been offered the great opportunity to have recent data that we didn't have before. So I often say to my team that we are fortunate in Franklin County to have had the Kirwan Institute, and they have done a good deal of data analysis and research about the aging population. And what it's telling us is different than potentially what we knew before, and that is that there are certain pockets of our community that really needs our support more than maybe others. And so how we are responsive to those folks, in addition to the folks that we will continuously take care of in our community, so all older adults, but understanding that there's higher needs in certain areas, and we need to figure out a way to be responsive and, stratify those folks that may need us a little bit more as important. I also believe that the data and just society is dictating a little bit different needs as well. So we have an opioid crisis that's happening in our community today that does impact the aging population. As much as it's not the first population we think of, it is impacting that population. And so how do we support efforts around kinship? How do we support efforts in prescription assistance and just different issues that arise as a result of that? There's a housing issue and crisis that exists in Franklin County that we're trying to help support older adults find appropriate housing. And so that's, while it may not be different than what was happening 25 years ago when we started, the levy services, I do think it's something that we need to start to think about in a different way. And so how do we help support folks that are dealing with these kind of challenges is something I'm focused on, and I hope to bring, forward for our agency.
I was talking to some folks from one of the aging organizations, and they're talking about how their residents all have little iPads, and all of the services are done through they are able to manipulate the apps on their iPad to request whatever needs to be done. So, if we hear this from employers, seniors can't use technology, but I think technology is really going to make a huge difference in a lot of what we're doing and able to help people to live their lives well, because the baby boomers may not be as tech savvy as the younger boomers are, but they're coming up pretty quick, because we have clients who will walk in and look at our job list on their telephone. And whoever thought when Employment for Seniors started 45 years ago, we'd be looking at the job list on our telephone. So, lots going on. Yeah,
there's definitely a shift in technology in our society as well. And, it's generational. And how far along folks are in the technology spectrum is something to be considered. But I do think as we continue on in our community, technology will enhance the lives of those that are aging. And as folks who are more apt to utilizing technology are aging, it's going to shift the entire way we do things. We currently push $7 million out in the community to provide transportation for seniors. And, I often joke that, in about 10 years, hopefully we won't have to do that, because I hope that we have a car that can just drive folks around.
Exactly.
But I can't plan for that today, right? I don't know that that's coming.
I'm banking on that.
Yeah. But when that happens, when that kind of technology hits the marketplace, it's going to change how we operationalize all things in the community. But you can't plan for that. So you have to plan for today. And so today we have a population of folks, some are tech savvy and some that aren't. And so we have to be very responsive to everyone's equal needs, and so how do we think about that, but yet look to the innovation that's coming towards us. So that app is a great example of something that's going to help reduce the need for maybe somebody in the home all the time. Right. But I also believe technology can inhibit us sometimes. So, I think about, what's happening just across society with smartphones and social media and all of that. It reduces, our interactions as a society, our person-to-person interactions. And so social isolation for those that are aging has a tremendous negative impact on someone's overall health and well-being. And so we have to be thoughtful, I think, when we do start to adopt that different technology, if it is creating isolation in a more intense way than what we, would expect without the technology is something to be thoughtful about.
Very true. I was giving testimony at the State House several years ago, and someone got up and said that older adults were not tech savvy, and I got up and said, in case nobody realized this, the largest group going onto Facebook were grandmothers. And to watch over their grandchildren. So, but if you can't, boy, talk about isolated from all of the fun stuff that's happening, even within their families.
Absolutely.
So. All right. You brought up earlier about age-friendly in the term, and that's a buzzword around here, especially since we've been involved with Age-Friendly Columbus initiative here the past 2 or 3 years, been one of the agencies helping out with that. It's grown to include all of Franklin County. It has completed the planning research phase and now moving into implementation of the strat plan. Give us your thoughts on the Age-Friendly project and the role you see the agency playing over the next few years.
Yeah, and I would say that Katie White would be really excited that you said it's a buzzword. So that means she is doing her job well.
Exactly.
Well, we're pushing as much as possible, too.
Yes.
I love it.
And Katie's been with us, and so we've talked about that. And when the Kerwin Institute originally did the study, and I don't know if it was Janet or somebody at Franklin County told them, well, you're not looking at employment. And they heard that from several people, and that's how they called me. Good. Everybody kept saying, you've got to talk to Carol, you've got to talk to Carol. But age-friendly is we're going strong.
Well, I think that's the goal, is for it to become the buzzword and the buzz action. So, how do we all become more age-friendly? And I am as committed to that as the next person. Katie White and I work really closely together. So in 2018, the Franklin County Board of Commissioners approved to fund age-friendly. So it would expand from age-friendly Columbus to age-friendly Franklin County. And I think that makes us one of the first counties to become age-friendly. And so that is very strategic, and it's very exciting. How we continue the good work that we're trying to do at a city level out, throughout the county. I think that age-friendly, it's a buzzword, but it needs to be an action item that we're all thinking about. I think about it on a regular basis. Every time I'm out and about, I'm thinking about that. And I think, having the ability, right now I'm participating with some Hilltop conversations. So the research showed us that those that reside in Hilltop didn't feel that they were connected to as many senior services. So the Age-Friendly data told that story. And so now we are in conjunction with Age-Friendly. Age-Friendly's hosting these, and I'm participating as much as I can to hear from those residents in Hilltop, to hear what their needs are, to really get that, person-centered response, to hear directly from those folks in those communities. And our hope is to continuously hear from folks aging in our community, to be able to apply programmatic responses to ensure that needs are being met. And so how do we apply that across the county? That's what we're working towards right now. How do we take that lens that's been on the city and apply it across the county and all the different suburbs and all the different communities, and support them to become age-friendly themselves?
I would encourage our listeners to pop back to the other podcast about age-friendly, because I think that what's so significant about that is that it brings in domains of issues that have not really been focused upon for the senior population. When you hear seniors, you hear healthcare, housing, transportation, and food. But there are other kinds of things. So we were excited because it was the first time we saw anything that looked at employment for older adults as a real issue. But also, it's communications. That whole communications section in the Age-Friendly Project. So I go back to my earlier comment of, well, I've been doing work in all of the different agencies for so many years. I thought I knew them all, but, every day I hear about something else. Well, if we haven't heard about all of these different agencies and resources available, how would the person in our community who is isolated, may not have all of the most up-to-date technology access, how would they know?
Yeah, absolutely.
Michelle, we've talked about all those senior services and the providers. 2 issues came up at a meeting that we were all attending last week with you, so that you had an opportunity to meet up with all of the different agencies that receive funding from Franklin County Office on Aging. 2 things that hit me, and there were a lot of issues, but these were sort of the 2 at the top of my list. The value of the agencies meeting together. And just what I just said, we don't know about each other, and how much better we are going to be when we know about the other resources, and how to strengthen those our partnerships or create new partnerships, but more importantly, to encourage and strengthen that cross communications. Our days are so busy. We've got so much stuff that's going on. What are the kinds of ways that maybe Franklin County can help us with that communication connections?
So, Carol, that's a great question. My previous time at the Healthcare Collaborative really taught me a lot about that connectivity to other entities. And so, I think what I witnessed last week was what I hope to be the first of many meetings like that. And so I hear what you're saying. Everybody has busy lives. But if we can, sketch out an hour a quarter to get together and have some facilitated, thoughtful networking discussions about how we can continuously strengthen our partnerships and work better together is something I'm committed to doing for those that are serving the aging population in the community. I think that's how we get to solution. I think that, nothing can happen in a silo. We can't create solutions in vacuums. We have to be collaborative across, all of us. And so hosting an opportunity for folks to come together and network and understand what each other are doing can help us to strengthen the services that we're providing in the aging network in Franklin County. But I also think that it, only opens up that cross-communication line. So right now, you may not know who you need to call at a certain agency. If you start to create those relationships in the room, then it's no longer a question of who do I call. I have a relationship, and now I can easily pick up the phone and make that connection. And that only helps the people that we're all serving. One of the things I'm very passionate about is the importance of not duplicating efforts that already exist in the community. And so how do we all do that warm handoff and ensure that, someone that's coming in for your service is going over here to receive a different service, but not the same service? Because what can happen is a lot of confusion for the folks that we're serving. The last thing, the systems around them are often very confusing in general. The last thing I want is for older adults and their caregivers to experience more confusion by duplication of efforts. And so how do we come together and really start thinking about who's doing what and how do we support each other better is something I'm committed to doing. So, more formalized structure of meetings like we had on last week.
And I was amazed at how many people were going to be there. Nancy and I had talked a little bit about her putting this meeting together, and when I walked in, there had to be 50, 60 agencies easily represented and probably 100 people in the room. That's a lot of services available to our older adults. And so, as I said, there's just so much that it's going on. For instance, in our employment area, there is duplication in that there are a lot of agencies who are helping people with employment, but that doesn't necessarily mean we're all doing the same thing, and almost no one has that same niche that we do, that completely open door. They may look at populations of older adults, but there are restrictions in that, and so we're real lucky that we're able to do it without those restrictions, which is real helpful. So. Great.
Yeah, and I think that's half the battle, understanding who all is working on which aspect of the services we're providing in the community, but that starts with conversation,
right,
and relationship building. And that's, something I'm very passionate about, is how we all strengthen our relationships across the aging network. But I also think there's a larger story to be told. How are we all coming together to do this? So the population in that room, in that meeting, so many people showed up and they all share a common mission, and that's to help people age in place. Right. There's a story to be told in Franklin County, and I'm so excited to be able to tell that story, and bring us all together and share it, and I think that's an important effort that we can contribute to.
I'm sure your learning curve's like straight up to learn all the agencies. But we often get a pat line from employers saying, no, I need someone who can work on a computer, when we say we're bringing them a very dependable older adult worker. Well, we provide over thousands of referrals each month and over the year's time, all using our job match system that's on the internet. So they have to, as we referenced before, look on their phone. They're pretty internet savvy when they need to be. We tell them about the innovative technology that we use to support our mission, which includes the training room we're in right now with a smart board conference room, along with lots of other things. We're advancing as fast as we can, too. Realizing you've been in the position just a few months, can you provide us with some examples of how technology can and will make seniors' lives even better, where you think the agency needs to go as well? I know recently a revamp of the website, much easier to navigate for users, whatever age. And that's a tip of the iceberg, I realize, of what you might be looking at as technology becomes more of our ingrained in our lives, as well as technology starts to mature as well.
Mm-hmm. It's a great question. And, technology, in the sense of general technology, I think there's tons of opportunities. Our website's a great place. I think that there's opportunities to even push things forward. So we operate the information and referral. So we have an information and referral line. Accredited information and referral line for seniors and their caregivers calling in. Is there an opportunity to add chat feature to that? It's not something I'm working on right now, but is it something we should explore? As needs change. I know that if I got on a website today and was looking at something, somebody would pop up and say, do you want to chat about it? And so how do we start to progress towards, technology like that? That's important. The data that we pull in at the agency is something that's near and dear to me. Just the work that I've done in my career, and the opportunity for data to tell a story in a way that we've never done before is very, very important. So like I mentioned earlier, we have research today that didn't exist before. Well, that research will start to dictate, how we respond in the community. But I also think there's an opportunity for us to be more thoughtful on the questions we're asking folks who call in, and then being responsive in that way. I just came off of a meeting that was talking about senior malnutrition in the community, and there's work being done around that, food insecurity screenings, different screening tools that could be embedded in a documentation system that could start to tell us a different story of the population that we're serving. We need to understand the population we're truly serving in order to serve them in the best capacity, but that takes technology. That takes, a good reporting system. It takes all of those different things. Connectivity. So you mentioned Facebook earlier. How do we encourage our older adults and the clients that we serve to connect in today's societal way of connecting to each other? That's always something that we're focused on, our social media and supporting our clients and letting them know what we're working on. But I think technology is just going to be a part of the future. It's not going to go anywhere. How do we support older adults with utilizing computers and technology is something that we will continue to focus on. I don't have a real direct vision on that right now, but I just think being aware and ready to incorporate that in our services is an important thing.
I think we approach it the same way, too. We see all these fun tools that we could possibly integrate, but I think we sift them out by going, okay, what's the end run, though? Is it just look cool today and it's going to do us really any good? Is it going to gather some information? Is it too intrusive that may not work and may backfire, or is it something where it's only going to be 2 years and it's no good anymore? Yeah,
and that's my response to it was primarily to the older adults that we serve, but thinking about how we communicate. So one of the things that I would say as well is that our interaction with the older adults is in order to, push them out into the community. And so how our partners, those that we are funding in the community, are utilizing technology is another lens to think about this. And so, how you all are thinking about technology, how our other partners are thinking about technology is important. But then how are we all communicating to each other about those that we're serving? So I think how we communicate with each other through technology, how we all know who is serving which clients, how we're communicating with the healthcare space is really, really important. So how are we communicating with a primary care physician to ensure that they understand we're helping support their patients' lives? And so that's part of what I was working on at Healthcare Collaborative, and I'm really passionate about. But it's something that as we go through this, that will surface as well, and we've got to think about that.
Yeah. Well, and like with the physician example just there, we're looking at technology affecting the lives of a senior, but the senior may not actually have to use the technology. It could be their caregiver,
right,
who could be their child or grandchild or a young caregiver who's been paid to take care of them. And so it's really looking at technology, like you said earlier. What do we have to do today? But we have to be prepared for that driverless car in 20 years too.
Absolutely.
So,
and quite frankly, this podcast was an experiment, but we know we're at the head of the curve. The audience demographic for podcasts really aren't quite this age yet, but it's creeping in there. But we establish it, and in 2 or 3 or 4 years, we are in the midst of podcast users. And our information will be plentiful, lots of content. It's going to be out there ready for them. And we'll be able to come in and say, this is our third year talking with you, and 3 years from now, that we can continue update. And we're ready for it with this.
Yeah.
As I mentioned, some of the podcasts we're doing is to feature the employers who are coming to us for a hiring event, and those actually have the highest number of downloads. So a senior, and for Employment for Seniors, that's 50 and over, might want more information about an employer before they actually come to interview with that employer. But hey, instead of going to the website, which may or may not tell you anything, or if you can even find it, because most of them aren't navigable, they can listen to a real quick 5 or 10 minute podcast and get the essence of what that company, what they're looking for in terms of new employees, what their culture is, why they want to work there. So therefore, that makes it a good place to work.
Yeah.
So our
great.
podcasting is, we are on the cutting edge. So, and the other thing I wanted to add to our discussion about age-friendly Columbus and the research and the data that we're getting, we're also looking at data from a younger perspective. So we're not waiting to 65. We're looking at 50 and over in a lot of cases. And again, that's why I love age-friendly. Then our shout out to Katie. But those 50-year-olds are going to be 60 really quickly. And so we have to just keep moving that along. So great.
Yeah,
right.
Proactivity is imperative. We all have to be proactive.
It is.
And that's definitely part of it.
So when you started working in the aging network, did you ever think that we would be talking about employment for older adults?
I don't know that I didn't think about it.
Okay, there you go. Well, our interesting story is we had a new client who came in last week who's 82.
That's a great story. That's
82,
awesome.
And it's because he wants to be engaged. Now, what we didn't get to ask him is if his wife told him to get out of the house, but he just actually retired 3 years ago.
Wow.
He wasn't a researcher, but assisting researchers. So amazing. So we're going to have some more discussions with him to see what we can do to help him. But seniors, we're seeing it all. We are seeing seniors who are taking care of family members, spouses, children, grandchildren. We have not heard that the reason taking care of grandchildren is the opioid crisis, but we're guessing that that's at least part of it. But seniors are looking to remain engaged. There was an article that came out last week in the AARP magazine, and the title was 70 is the new 65. It's a little scary. But the notion is that we've always had this traditional notion of retiring at 65, and nobody knows where that number came from. And it's because of the way Social Security is set up and all different kinds of things that are going on, plus the fact that we're living longer. All the retirement guys are saying wait till 70. Don't retire till then. So we're seeing it all here. We see people who absolutely have to work. They have $30 in their checking account and no money to pay rent. People who just want to remain engaged. We're doing a lot with individuals who are looking at encore careers. They've had successful careers, they're fine and dandy, but they're out for a year and they are so bored they have got to do something else. Our seniors bring experience, talent, maturity to an employer. And employers often call us and say, please send us somebody who's going to show up for work. So I'm just kind of interested in hearing from you and Janet about what are you hearing from your side of the perspective? Are employers calling you? Are clients calling you and saying, I want to go to work?
I'm going to default to Janet to see if she has anything that's been percolating, and then I'll respond.
Well, part of my job is outreach. So I'm often out in the community, and I have the gift of being able to interact with a lot of older adults that participate in our program. And having been at your Employment for Seniors Expo, I have seen a lot of people come through who are interested in being employed for the same reasons you mentioned, whether it's for economic reasons or for socialization. So, and because I have moved into that young senior population, I understand how they feel, continuing to want to be engaged, wanting to work. I can identify that, and I do see that being a trend in the community as the younger people are becoming more involved in the aging process. There is a need. There's a question about whether they want to work, the need to have employment. The younger population, that's what they're looking for. They want to be able to be engaged, and they want to be able to continue to work.
We had a wonderful career expo last year. We had 78 employers and about 600 participants, and we still have months to go for this year's program, and we are already over half booked registrations for the employers. So it's going pretty much gangbusters. And as I tell my clients, they're not going to pay to come to our expo unless they are really interested in you, because they know that the people who are going to show up are not only going to be older, but they're actually going to come ready. They're going to come dressed for success. And so they have we've had a great program. So we're looking forward to you coming to see us this year.
Yeah, I would love that. That'd be great.
Well, maybe now's a good time to ask Michelle for some ideas of things that she would like to talk to us about on what's going on and how the community can help you in your job.
It's a big question. So I think, just open dialogue is the biggest thing for me. How I can be successful is relationships, events like this, getting out and meeting with the community, hearing what the needs are. I think that's the important thing. Having the understanding and the patience to know that our demographics are shifting on a regular basis, and so we have to be responsive, but we also have to be thoughtful. And so how do we do that collectively is an important question that I keep coming back to. Understanding that the needs today are different than they were 25 years ago. I spoke to that earlier, but I do think it's something that we have to be thoughtful about. We have to be thinking about, how do we continuously serve a population that is changing, be it generational, be it just, technology or what that might be. But the needs are changing every day. So we have to be thoughtful in that. And I think open dialogue is how we get there. Hearing, last week we spoke about the meeting we were at together, and hearing directly from folks that are serving those individuals in the community is an important exercise for me. I've been away from direct practice for 15 years now, and I'm never going to pretend like I'm doing it today still, because I'm not. And therefore I need to hear from the folks that are out in the trenches doing the work, as well as hearing from the older adults themselves. So the focus groups I mentioned earlier with the Hilltop population, it's so imperative for us to hear directly from folks about what are the challenges that they're faced with, and then think about how we utilize, the funds that we have available to try and make impact for those populations. And so that's, just the patience to do that, the understanding that the need and the open dialogue and partnership is just something that I would ask for from the community as I get my feet wet and keep pushing forward.
Well, and I think too, as you said, hearing from the community, they need to know that it's there is somebody at the other end of the telephone when they call Franklin County Office on Aging to talk to them about their issues and their needs. There's not going to be any immediate answers, but dialogue is going to help us get to that point. So great. Thank you so much. Michelle, thank you very much. Congratulations on your new position at Franklin County Office on Aging as the new executive director, and we really appreciate your partnership, and all of your colleagues are my I'm in awe of everything that they do. Janet Caldwell, thank you so much for coming today, and I appreciate everything you do for us, and wish you both well and good luck. And please know that I'm always at the other end of our telephone too, if there's anything we could do to help.
Thank you guys so much.